Is it really hip bursitis? Common condition or common diagnosis when someone is having hip pain is it's called hip bursitis. Usually, most commonly, this is applied to females. Guys can have this too. But in this case, this particular patient presentation, this was a female that came to us and was having occasional pain in both hips. One of the things in the history is if it's an occasional pain or intermittent pain in both hips, a lot of times we need to look just a little bit further north, or in this case, up from the hip joints, actually up to the spine, and figure out what's going on. If you've been working on the hips, been treating the hips, nothing's getting better. Like I said, we have to figure out, we have to look at the place where the nerves that make the hips work are coming from. In this case, it's the low back. So for this particular patient, we did a few different tests. We got an assessment of the hips, we got an assessment of the low back. Low back wasn't moving quite as well as it has in previous visits, so kind of helps to know previously how the patient's been moving. But in this case, we started moving them around. We could change the hip pain. We just, for the heck of it, we did a few different hip exercises that commonly help knock the hip pain stuff out. Nothing changed. Also gave us a telltale clue. We need to look to the spine. We started moving the spine around a little bit, and that's when we started to see some changes. So why is that? So pain was on the side of the hip, or the outside the lateral portion of the hip, through the glute muscles themselves. In a typical presentation, pain, the hip will usually hurt after sitting for a while. It's very difficult or painful to lay on the affected side, and sometimes it's even difficult to, the painful side, it's even difficult to lay on the non-painful side. But in this case, as we were moving them around, we discovered, hey, we could change the hip pain, we could change the symptoms by moving the low back. And why is that? So moving over to our spinal nerve chart here. So we've got the hips right in through here. If we trace these big nerves back to where they come from, back up to the spine itself, that's the innervation of the hips. That's what gives the hip muscles their strength, their power, and also their sensation. If something's going on at the low back, anything further downstream around where those nerves travel can possibly be affected, and that was the case for this person. So when you get the correct strategy in place, a lot of times you can clear up weird hip pain that isn't responding to anything else.